Conversations, brought to you by the Australian College of Rural and Remote Medicine. Here we will talk with dermatology experts and rural doctors about ways to care for patients in rural communities. Sit back and enjoy the conversation.
So, Dr. Foster, what inspired you to join the ACRRRM Tele-Derm service?
I think I was invited. I think I started in 2015, which was a while ago now. But look, I've always been interested in rural health. I did a year of my medical school training in Kalgoorlie and subsequently worked in Kalgoorlie as a junior doctor. And I've worked in the north part of Western Australia and done rotations in the southwest of Western Australia and also in Queensland and the Northern Territory. And one of the difficulties when I finished my training was that I had small children. And so visiting the rural parts of WA became a little bit more difficult, especially when they were very small. So it was a way to stay connected with rural health and feel like I was giving something back to rural health that was manageable within my family at that time as well. And Jim Muir is a very well-known colleague within our college, a real contributor, and it was just a real opportunity, I suppose, to work with him as well.
Yep. Thank you, Dr. Dr. Foster, research shows that telemedicine for children disease is very valuable because usually parents should accompany their children for a medical visit, which increases the cost of travel and parents' work leave for that purpose. Given your interest in pediatric dermatology, how important are services like Tele-Derm for kids living in rural, remote, and Aboriginal and Torres Strait Islander communities and their parents and carers?
Look, I think Tele-Derm provides an opportunity for some service where in the past none has been available, so it's been incredibly valuable in that sense. I think my experience of either store and forward or video consultations for dermatology has been that a face-to-face consult is still the gold standard. I do increasingly use some store and forward and tele-dermatology in my rooms in the context of follow-ups, but for first patients I do like to see them if I can. But certainly Tele-Derm has allowed me to see some of the opportunities to help guide patients. And it's certainly with the context of GPs being in a liaison spot, it makes it a lot easier. I think when you've got just the patient on the other end of the line, it's a lot more challenging. But when you've got the GP as an interface, it can make things a lot more efficient. So I think it would be wonderful if everybody could access a specialist face-to-face, but the reality is in Australia, because of the distance and because of the population and because of simply the low numbers of dermatologists that we have, these sort of platforms give people the opportunity to have specialist care where there otherwise wouldn't be that opportunity. So I think it's really important.
Okay, thank you very much. And my next question is, in general, what kind of children's dermatology cases do you see most? Is there any difference between Western Australia and other parts of Australia in terms of, dermatology disease, particularly in children age?
Look, I think the most common things that we would see at the Children's Hospital and probably in private practice as well would be birthmarks and eczema. They would be above and beyond the most common. Pediatric dermatology has a lot of intersection with genetics, and so there's a lot of conditions that will be diagnosed in that time frame that perhaps adult dermatologists don't see so much of. And certainly the store and forward technology can actually be quite good for individual birthmarks, vascular lesions, things like that. And you don't do so many skin checks in children, So store and forward is very difficult for something like a skin check, but for, say, a sebaceous nevus or a hemangioma or things like that, you can often be quite clear with the diagnosis through a store and forward type technology. I think eczema and other inflammatory rashes can be a little bit more tricky. Just capturing, one of the challenges is often capturing the distribution because a small area, a photo of a small area sometimes doesn't quite give you the sense of what's going on. And I found that the doctors using Tele-Derm particularly have been good about, if we ask for more photos of more areas or different morphologies, they will often come back with more photos. But I think it's a really important thing to take more photos rather than less, because all that information is important for us. And even if you don't necessarily post every photo, it's often better to have them and then be able to post them later than have to get the patient back to get more photos, if you know what I mean. Yeah.
Yes, yep.
One of the challenges in children, and adults too, but particularly children, they'll often have a lot of rashes. So they might have keratosis pilaris, say, and eczema, and then they might get a viral rash. And so that can make it tricky for us, because you might get a picture of a morphology that doesn't fit the history of what the doctor is asking a question about. And there's a sense that perhaps there's another rash, or the photo hasn't quite done the presentation justice. So I think more photos is often better than less. Yeah.
Yep. Thank you very much. And based on this question, my next question is, do you think rural doctors are prepared for dermatology disease in children?
Look, I think we've got. Sorry, that's my dog. Apologies. She doesn't like anyone sitting with us. Look, I think dermatology training during medical school could be a lot better. It probably doesn't occupy enough of the curriculum, especially when you look at what percentage of consults in general practice are dermatology related. We certainly, if some of the figures quoted are 20%, we certainly don't get 20% of the curriculum in medical school for GP, for example, which is, I understand that. Obviously we're trying to teach people to not miss things that are going to cause someone to die. And a lot of the derm things, apart from, say, melanoma, are more chronic diseases. But I think that often people do feel underprepared, and training could definitely be improved. One of the things I find about rural doctors, though, is that they tend to have the best skills in dermatology of anyone. And I think that's often because they have that generalist sort of vision. But I also think it comes down to the fact that, for better or worse, patients often can't go somewhere else. So I'll often see patients in the city who maybe have seen 20 different doctors, and they go for the second opinion after second opinion after second opinion. And that leads to a bit of bias in some of the doctors, in the sense that when the patient doesn't come back, they assume that what they did worked. Whereas I think in the rural settings, when the patient doesn't get better, they go back to that doctor, and the doctor then gets that feedback. Oh, that didn't work. What is the diagnosis? And so they sort of have that inbuilt follow-up mechanism that we don't always get everywhere else. And I think it does result in them getting much better at diagnosis, much more experienced in terms of treating different things. And just generally having a better overall dermatology knowledge, I think.
Thank you. Can you tell me about any particular cases that stick in your mind? Perhaps one that demonstrates the real value of using the Tele-Derm platform for education and advice? I'm looking for a interesting case you can describe for us.
Walking over so I can shut the door on my dog's. Apologies. She's very barky these days. Look, I think in terms of interesting cases, one that comes to mind is a GP supervisor of mine when I was a medical student in Esperance in Western Australia had a case of a lady with an unusual eruption. And in the end, we advised with regards to differentials and biopsies, and it turned out to be an atypical infection. She was a lady who was on immunosuppressive agents and had developed a very unusual infection involving her face, which was much more difficult to diagnose than the average rash. But between Tele-Derm and then using the video consultation service through Fiona Stanley Hospital, the patient was able to be managed for a really complex infection without ever leaving Esperance, which was a huge benefit for, I think, the patient, but also a huge cost reduction to the state as well. And I think really satisfying for the GP as well to make that diagnosis and then see the whole treatment plan through in conjunction with the infectious diseases doctors. So those cases are really great where you think you've made a big difference. You've got the right diagnosis, the patient got the right treatment, and they were able to access all that without leaving their small country town. Yeah.
Okay, thank you. Just one question to go, Finally, what makes you proud about being involved with Tele-Derm?
I think one of the sad things is that within the Western Australian health system, we don't yet have a really fully functional way of liaising with rural patients through the hospital system. We were unsuccessful in obtaining funding for a teledermatology service through the tertiary hospitals. And so there isn't really a good way for rural doctors to get advice from a consultant without patients coming into clinic. It's very ad hoc. So I'm really proud to be able to say to those people who call up or ask our registrars that there actually is a service available for them that's simple to use and that's clear, and where they'll get advice in a short time frame, because otherwise there just wouldn't be anything like that available to them. Other states, I think, have got some teledermatology available through the public health system, but Western Australia hasn't yet, and it's really valuable to those people.
Thank you very much, Dr. Foster. I have extensive experience and publication in the field of telemedicine, and as an expert in this domain, I would like to appreciate you, because the system you are helping doctors is unique in the world, I say, in terms of a sustainable system and really a fast response to the query, GP's queries. What you are doing is one of the best in the world, and I want to appreciate your effort. We are all proud of this service, and thank you very much for this task.
Oh, thank you. I think one of the real strengths of the service is that rather than just providing a patient interaction, it gives education, and you certainly see that in the GPs who do use the service, that they get better and better and better as they post, and then they often stop posting as much, and I think that's probably because they don't need any help anymore. Yeah, so it is great to see people upskill and really start to enjoy dermatology. It's a really great thing. Thanks so much.
Thank you very much. Okay, so we are in the end of the interview. Thank you very much for your time, and thank you, Jane, for helping me.
The ACRRM Tele-Derm is funded by the Australian government and is available to all Australian rural doctors working in MMM3 to 7 and also all ACRRM members. Should you have a case you wish to submit for advice, go to the discussion sections of the service. If you want to contact us, you can either email the digital health team at ehealth@acrrm.org.au or call us on 1800 223 226.